think the one thing that gives me solace, it's going to be huge for me, is I know Avery would not be here if it wasn't for me. And I finally own that. Avery shouldn't be alive. Avery has had so many chances that he should have been gone. And the decisions that I've made for Avery, I think have kept him where he is. And so I've done right by him. I've made decisions that are right for him. And I know that when he leaves me and us as a family, I feel like he's going to be like, Mom, thank you. His body won't work. He's done. I don't know how he stays alive now, but I know it's the love that he gets. It's a higher level. It's not anything mechanical. I think it's really just out of love, and he will leave me and us, Janessa, Isaiah, even the dog, Rick, when it is time, when he feels like he's completed his mission, I guess. And I will have peace knowing that I've done everything that I can as his mom. So there won't be any guilt. It will just be just pure sadness. Just pure sadness and missing him and trying to lead a life with that hole. One of the best things that a mom said, she had a son that died of mito, and I said, how do you go on? And she said, I did this, my son, for all those years, and I'm okay. We miss him, but I'm okay. And I feel like that, I hope to be me, that I just know that I will be okay in terms of there will be no regrets. It will just be sadness and just my heart broken and missing, him.
For me,
dearly.
that clip is everything. For a parent who knows that they're going to outlive their child, the bottom line is having no regrets at the end. You want to know that you've left nothing on the table, that you've done everything you could to be a good parent to your child. As it turns out, the good parent concept is an area of research in pediatric palliative care. Parents of seriously ill children have deeply held beliefs about what makes someone a good parent, and they make medical decisions based on what they think a good parent would do. This is a very important concept because it helps us understand the motivation of parents and makes it easier for us to meet them where they are. If you're interested in the research, there'll be links to references at the end of this module. These are the key points from the good parent research. Number one, being a good parent helps the parent. Achieving their definition of good parent is very important for their emotional survival. In the case of bereaved parents, it affects their sense of guilt and peace. Basically, it helps them live without regret. Number two, it's definable and distinct. There are some common themes that parents use to describe what a good parent does, like making sure my child feels loved, taking care of my child's health, advocating for my child with staff. Number three, the definition can change over time. Changes in the clinical picture, increased awareness of prognosis, and family dynamics can all affect what parents prioritize. At diagnosis, a parent may prioritize being informed and advocating for their child. Later on, their number one focus may be something else, like making sure their child feels loved. Number four, interactions with staff can deeply affect a parent's ability to be what they think of as a good parent. It's really important to let parents know that we think they're doing a good job. During the worst phase of my daughter's illness, when we couldn't keep her out of hospital, I felt like a failure because my job was to keep her healthy. During her last hospitalization, one of her doctors said, "We know how much you're doing at home and how hard it is." That simple acknowledgement was profoundly comforting. It let me know that my daughter's decline wasn't my fault, that it wasn't because I was doing something wrong. Knowing that our medical team wasn't judging me helped me stop judging myself and made it easier to accept what was happening. If I, as a physician, needed to hear these things, imagine how much parents without medical backgrounds need this kind of affirmation. We've all taken care of families who chose things that we did not recommend. In this next clip from CPN, a pediatric palliative nurse talks about how hard that can be and the importance of understanding the thought process and motivations behind their choices. This, by the way, is something that is not unique to pediatrics. We need this skill set to take care of patients of all ages.
I have definitely struggled sometimes with decisions family members make because the only time that's ever been is from my perception as Shaylin. The child appears to be in pain or at a higher level of agitation than they need to be. And the only time I've ever really struggled with that is when I know we can do interventions that will help a little bit. I can't ever cure or fix generally what's going on, but I know it will help. We can improve where they're at. But sometimes parents don't want to take my recommendation, and they don't have to. It's their kid, it's not mine. And I have definitely struggled with that. I think now I have a better understanding of every parent is different, and so it doesn't get under my skin as much as it did the first time it happened. And the first time it happened, I was calling our program director and I was calling the PAC team and how are we letting this happen? And everybody had to sort of be like, not your kid, not your decision. You did everything that you could, and that needs to be what makes you feel better about it. But not everybody is going to take our recommendations, and their recommendations, they're not orders, and they don't, even if it was an order, they're in their home, they don't have to do it. And so I think my approach to it now is recognizing when it does upset me and why does it upset me, and then trying to understand why the parent is making that decision. And if I can meet them where they're at and making that decision, sometimes I can help them see that my recommendation is going to be helpful, but I can't do that with forcing the information of the recommendation at them. I have to do it with sort of understanding where they're coming from and the barrier.
This next clip from Courageous Parents Network has a mom who talks about all the things that she felt like she had to do to be a good parent of a child with a complex chronic condition. The sheer volume of things that needs to get done can be overwhelming, and it's easy for parents to feel guilty. So be on the lookout for this in your families. Help them prioritize tasks and let them know that they're doing a good job.
It's so fraught with like what's not being captured is like we would hope for a change, and then we'd plan and would work so hard on it, whether it was OT, PT, speech, and then it wouldn't happen, and the devastation you feel. And at some point, whether it's acceptance or whether it's resignation, I don't know, but it just, do you stop trying? It's not, you stop trying because you're still doing all the care and you're still trying to do all the supports, but I guess there's a realization that you may not achieve that. And while there is a huge letdown and it can be demoralizing to have that realization, there's also a freeing and a sense of maybe it's not so critical that we push everything, and maybe we are able to set a little bit less stressful priorities. I remember when Katie was little and, EI would come and the OT would work with her and say, now I want you to do just these two things, this and this, and tell me how it goes next week. And I go, oh, okay, and the teacher would come and say, make sure you try doing this during feeding. Oh, okay. And then who else? Speech or somebody would say, give another little homework. And each one was very reasonable. But by the end of the week, I had 12 things I needed to try, in addition to giving her 14 medications 4 times a day and remembering the timing of which one goes where. And it's like, it became absolutely overwhelming. And yet I felt like I had to do every one of those things to be a good parent. And eventually you realize you just actually can't. I mean, maybe some women and families can, but I couldn't. And so I had to kind of start taking that information in, not disregarding it, but using it to figure out what my priorities are for Katie and what, my partner's priorities were for Katie, and put the most attention to those. Even if that meant that some days I had to say, we didn't try that this week, or no.
These parents had a daughter with Gaucher's disease, a metabolic syndrome. There's no treatment for this, and the mom here talks about the struggle of not, quote, doing something, because as parents, our instinct is to do everything we can for our child. Their palliative physician helped them see that they were in fact doing things by actively preventing interventions that weren't right for her. Basically, he let them know that they were being good parents.
We had talked to one of our palliative care doctors months before, and I was having a really hard time with the idea of, with the disease that she had with type 2 Gaucher's, because there's nothing you can do to try to cure it. It felt like this feeling of, we talked, we want to give quality of life, but it felt like this feeling of doing nothing. And it felt so, it went against like every instinct as a parent to have a sick child and just not do anything. And then, so then when you think about interventions, to think, well, here's an intervention. What is that? Even though we had talked about it, there was this like instinctual part of me that felt like, well, if I say no to doing something, that just feels so, it goes against my almost instinct on a primal level, not on a, well thought out, what does this really mean level. And so I think one of the things that I think was one of the most impactful things that our palliative care doctor said to us, because we had talked at this point for months with them, and they kind of knew what our thoughts were and kind of what we wanted. And so at one point I talked to him about, feeling like I'm not doing anything. And he had said in a really eloquent way that I'm not going to quite get, how in the medical field, there's lots of things that that they can do to keep a body alive, and that they can keep doing and doing and doing all kinds of things to keep, and some of them painful and some of them life-changing and whatever, but they can do a lot to keep a physical body going long beyond when it otherwise would. And so he had said, maybe you could think of it as what you're doing is you're actively protecting her from some of the things that could be done that wouldn't be the right things for her.
Here are some QR codes that can take you to some of the good parent literature.